Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and I wanted to tape a special Thanksgiving video today so that those who are healthcare coverage winners know they are and can give thanks for that. Now, many people think coverage is more similar than it is, and that couldn't be farther from the truth in our country. So we'll do another video on healthcare coverage losers, but we know from your feedback people like shorter videos. So today we'll just focus on winners, but I do have to talk about a group that will be in the loser category so that the winners appreciate their situation. And so I have friends who forwarded me their renewal plan for 2023. They are both in their 60s, but not yet Medicare eligible. And their renewal shows a monthly premium of $3,010.52 a month for the two of them. And they would each have a $6,000 deductible. So that is a lot of money. And let's contrast the situation with our group of winners. I would say that the winners are those who have active group coverage as government employees. They are usually treated very, very well by our system. They contribute very little. They have very small out-of-pocket costs. And what's scary about the group in Congress is that they actually have quite a bit of influence over the rest of us without perhaps really understanding the pain. Then my next category would be having coverage through a large group employer that is self-insured, as opposed to smaller employers tend to be fully insured. And remember, self-insured are those big companies that pay insurers to process claims with their money, whereas smaller employers tend to be fully insured. They pay a premium to an insurance company that then processes claims. And insurers will tell you that they don't distinguish between the two groups, but I would say if you're being paid to pay claims and it's not your money, that is a very different situation from paying claims when it is the organization's money, and the more you pay in claims, the less there is for other things. So we'll leave it at that. Some would say, well, why haven't you mentioned Medicare? Medicare is right up here at the top. Most people are very, very happy, transitioning to Medicare. But I should say that if you've had that rich group coverage and all your doctors were in network and you hardly paid anything, and then you're a high income person that transitions to Medicare, you can have some level of shock realizing that Medicare is costly for higher income Americans, and Part D doesn't have an out-of-pocket max yet, so you can be taking expensive drugs that you had more protection from those costs. You also have a problem of sometimes practices saying, well, we don't take any more Medicare patients right now, new Medicare patients. So with Medicare, the vast majority of people are very happy with it, but there can be issues. The next category of winner, and this is just, Maura Carley's opinion, are the people with subsidized individual coverage, those eligible for premium tax credits, especially those who live in low-cost areas of the country and able to deal with those plans that have narrower networks, which we've also discussed. And at the end of the winners list, many of them wouldn't feel like they're winners, but I would say people on Medicaid have not as good access to services as others, but it is comprehensive coverage, and they don't pay for it, and so I would have to include them in the winners list rather than the losers list. So again, one of the objectives of this exercise is to show you that coverage is not all the same. My friends here are going to pay $48,000 between premiums and deductibles before having covered care, except for the things, the WellCare items that Obamacare includes in the premium, like your annual physical. All right, I thank you for listening. Happy Thanksgiving, and tell other people to watch our videos and learn about healthcare coverage. Thanks so much. Bye-bye.